Speech pathology can be an awesome and rewarding career, but it's definitely not for everyone. So today I'm going to help you decide whether or not you should study speech pathology. Hi, my name is Justin and I'm a qualified speech pathologist. Welcome. Speech pathology is a very rewarding career. Your whole career will be devoted to helping others, which is amazing and fills me with so much happiness. I really think that one of the keys to life is giving back to others and helping others as much as we can. And I think that brings a lot of happiness to us. So that's one of the main reasons I chose speech, because it's really, really rewarding. Speech pathology is a really diverse career because there's so many different environments you can work in as a speech pathologist, and there are so many different client populations that you can come across as a speech pathologist. A lot of the time, people will specialize in a certain area or a certain client population in their career, but there's just so much range of practice you can go into to always keep the job fresh and interesting. So what do speech pathologists do? As a speech pathologist, you'll be helping people with their communication, and you may also help them with their swallowing, so their eating and drinking. As a speech pathologist, you'll work with people with speech disorders, language disorders, voice disorders, swallowing disorders. There are lots of different types of communication and swallowing disorders you can help people with. And I'm kind of making this video to get you to think, where would I like to go, and do any of these areas of speech pathology sound interesting to me? So what type of person suits speech pathology? Not everyone suits speech pathology. And when I graduated speech pathology, I think I had about 15 people graduate with me, and it was about 100 people starting the course. So there was a huge dropout of people starting speech pathology, and by the end, the number had just dwindled to 15. And that's why I really wanted to make this video, because I think a lot of people go into speech pathology not being suitable for it and not kind of knowing if it's right for them. So if this video can help you at all kind of work out if the career and the course is right for you, I would have done my job. And that doesn't mean that you're not good enough or whatever, just some people have different skills suited to different things. But the first thing that I would say is a really important thing in speech pathology is social skills. Really good social skills help a lot in being a good speech pathologist. Because the career involves helping other people and dealing with disorders of communication, it may seem obvious, but just being able to communicate well with people is really important. And building rapport, getting people to trust you, getting people to like you so you can help them with their treatment. Because if someone doesn't like you, it's very hard to get them to do anything. And a lot of these people will be going through some of the worst times in their life if they've had a stroke, or they have stuttering and they're very anxious. There are just so many areas where you kind of need good social skills to help your clients. And this kind of goes across every population that you can work with. So for example, if you work with children, you kind of need to be good with children. You need to make them have fun and kind of interact. If you kind of like have a small social battery for people, it can be very difficult as a career unless you kind of work in the research side of speech pathology. But as I've kind of said already, a lot of the jobs will be one-on-one working with people. And if you don't have the social skills, you might struggle a bit. I'm sorry to say, you might struggle a bit. It is also really important to be quite an organized person. In the past, sometimes I have not been the most organized person, but I really had to step my game up as a speech pathologist in organization, because you're going to have lots of clients coming in from every angle at you. You're going to have reports to do. You're going to have notes to write. You're going to have meetings to have as a speech pathologist with multiple different people. So you might have a meeting with an occupational therapist because you work in a team some of the time. And if you don't have strong organizational skills, you will really start to sink quickly, I think. And I mean, if you're good at like creating lists, kind of organizing your calendar, these are really important things to have. And I'm not saying if you're not organized now, you can't get organized, but keep in mind, if you think that might be an issue, you might have to improve your organizational skills, because organization is huge in speech pathology. This might not apply to every single speech pathology job, but as far as I'm concerned, it applies to quite a few of the speech pathology jobs. And that is being creative. It really helps to be creative and kind of make your therapy sessions fun and interactive and help the people engage with the treatment. So for example, especially in pediatric speech pathology jobs, it's really important to keep those kids engaged, having fun, and this might involve getting creative with the way you do therapy. This might involve using some arts and crafts in therapy, kind of adding a game to therapy. So for example, one of the boys I was working with the other day, we were working on his k sound. And every time he said k, I would give him a piece of a Jenga block and he would build the tower. So that kind of really helped him engage in the task, and there was some kind of reward. So you don't have to be a Picasso or anything when I say be creative, but just little tricks and tips that you can think of to make therapy fun and engaging. Obviously, if you work with adults, you're probably not going to need as many creative things because you can just, they won't probably disengage so quickly. But that's also one thing to keep in mind. Being creative can be really helpful as a speech pathologist. About the degree. So the first thing I'll say about studying speech pathology, it is pretty hard. When I first studied, I had no idea how hard it was going to be. I won't say I thought it was going to be a cakewalk or really easy, but it definitely tested me, and that involved really applying myself to the study and putting my head down and just putting hours into studying to working hard at it. So I think if you kind of don't really want to be a speech pathologist and you kind of half in it, half out of it, and you don't really want to put work in like to studying, you are going to struggle. I know it's kind of not a degree where you can go partying every weekend. You need to be putting your head in the books and really getting into it. So prepare to study your little butt off if you start speech pathology. I'm now going to go into all the different environments you could work in as a speech pathologist. And this is really important because some of them might be more interesting to you than others. Hospitals and clinics. So as a speech pathologist, you might work in an acute care hospital, a rehabilitation center, outpatient clinics, and specialized clinics focusing on specific disorders. So for example, you might work in a hospital with adult patients who have just had a stroke. You might work in a rehabilitation center with people who have had a traumatic brain injury from a car crash. You might work in a children's hospital with children who have got a cleft palate. There's so many different ways, even just in the hospital setting, and so many different patients you might work in. Schools. You might work in schools. So lots of speech pathologists work in schools with children and the pediatric population. And this is likely to include language and speech disorders. So you wouldn't be working with clients who have just had a stroke in a school. A lot of the school speech pathologists target speech sounds and language ability. So if you think of speech sounds, that's the way we say our sounds. So ch, j, and our language is the way we express ourselves. So how many words we use in sentences, our grammar we might work in schools, and our understanding of language. Private practice. As a speech pathologist, you can either work for someone who's got their own private practice or go into your own business by yourself. And you can kind of choose your caseload. You can work with school-age people, you could work with adults. This is kind of when it's up to you to choose who you want to work with. And if you're more business savvy and entrepreneurial, this is the avenue you might go down. Private practice. Early intervention programs. If you are someone who prefers working with younger kids, so infants and toddlers, you could work for someone who does early intervention programs and specializes in children who are just developing their language. So this would be children who are learning 1 word, 2 words, very early stages of language development, who are slightly behind their peers. You might work with these children to help them communicate. Nursing homes and long-term care facilities. So if you don't like working with children, this could be the job for you. A lot of speech pathologists in this population help people with their swallowing, their language, their ability to use speech, and a lot of these populations have had strokes, they're getting dementia, so you'll be helping them with their swallowing and their ability to communicate when they're coming to the end of their life. University and research centers. If you really like your research, you could get into a research role as a speech pathologist and help drive the research in speech pathology. This could be a great job for you if you kind of don't like the clinical side of speech pathology and prefer your studies and getting down into the books. Also a great option for people maybe who are a bit introverted and prefer not to be so people orientated all the time. Telehealth. Since COVID happened and it was terrible, a lot of jobs have come into play working in telehealth. So some speech pathologists have their own businesses or they work for others and they work via telehealth. So they give intervention and assessment on Google Teams, they might use Zoom, whatever the latest video communication platform is they'll use. So this is another option. You can probably travel a bit, you can be more remote. Another option if you prefer not going into an office every day. Some speech pathologists see their clients in their office, and some are community-based. So for example, if you're a community-based speech pathologist, you'll travel around in your car and you'll drive to people's houses and conduct your treatment and assessment in their own house, compared to if you have your own office. So this is important to think about when you get a job. Where would you like to work? So those are some of the career paths a speech pathologist has. If you have any questions, drop them in the comment section below and I will answer all of them. If you have got to the end of this video and you've decided this sounds pretty cool, definitely go for it. I'm really enjoying my career as a speech pathologist. There's definitely challenging aspects to the job, but overall it's very rewarding and I highly recommend it. So I hope you've got something out of this video, and please let me know how you get on. If you have any questions, hit me up in the comments. And stay in touch because it's a wonderful career and I highly recommend it. There's also lots and lots of jobs in speech pathology, especially in Australia. So if you want a job, and I know sometimes a lot of degrees don't lead to jobs, unfortunately, speech pathology leads to a lot of jobs at the moment in Australia, which is amazing. But yeah, I hope you enjoyed the video. Please like and then subscribe, and I'll see you back here next time because we're going to be talking a lot about speech pathology on this channel. I've devoted this channel to speech pathology and to helping clinicians, to helping parents, anyone who's struggling with their communication and wants some tips, some tricks. Yeah, I'll see everyone back here next time and have a wonderful day, guys.